Assalamu alaikum. Today we will have a topic regarding how to approach short case in ophthalmology. So to discuss on this, we have a pyramid by the name of Miller, and he has described how we will assess or evaluate a student or a person or a postgraduate resident based on this. We have different levels. Number one, if the patient just they know initial concepts regarding that particular topics, if you want to evaluate that based on MCQs or false or correct questions. Then the next level is that how you will if you know something but knows how, that is interpretation or applying of your knowledge. So for example, there will be the essay questions, there will be some kind of extended matching type questions, and the next level is you have to show that you know something, you have to show. For example, I will give you just example, like if you know the visual a Miller pyramid. In Miller pyramid, that has different levels. It means, so if you have just read some concept, so you have read that if someone to evaluate you, they are giving you MCQs, true or false questions. So this is a low level question just we had in our schools. So in theory exam they are just evaluating you know something or not. But in actual exam, in viva exam, they are evaluating also that is a higher level, and you will apply your knowledge. Aim of that is case-based discussion, that you have to just elevate your level, and you have to debate on a specific topic. Say, for example, they will give you a scenario. A 45-year-old hypertensive patient presented with sudden loss of vision. So this is a scenario. So you will find there will be multiple answers, and you have to debate on that. It shows you have demonstrating of learning. For example, we are simulation, we are OSCE. For example, you know well that visual acuity, how you are defining the visual acuity, what is the different parameter characteristics. For example, they will ask you to take this patient and come here, this is the Snellen chart, do the visual acuity of this patient. This is the next level. So if you have not done previously this visual acuity multiple times, so you cannot do. And the examiner want to evaluate that in actual exam. The next level, which is performance integrated into practice through direct observation. For example, WPBA, workplace-based assessment. This is the most higher level of your assessment. For example, you are doing cataract surgery. At the end of the surgery, your professor is coming and he is asking you, please stop before closing your wounds. He is coming and he want to confirm the lens you have implanted. Okay, that is in the bag or not. Just he want to evaluate you. So, for example, he is not evaluating the whole surgery, not step 1, step 2, step 3. He is just asking for the result. This is workplace-based assessment, which is the most important. You know, in ophthalmology, when you are appearing in any exam, if that is IMM exam or if that is Part 2 exam, they are asking for this workplace-based assessment. They are not giving you, for example, that your case will be from orbits, it will be from proptosis, it can be from strabismus. In general, you have to know everything, different steps. So you have to master all that. And most of our PGR who is appearing in Part 2 exams, most of them, they are not filling in talks. They are filling in the short case or also in the long case. So you know, when you are appearing in the second day, your short case can compensate for long case or long case can compensate for short case. Talks cannot help that. So if you want to pass your long case, so you have to master short cases. This was the importance. And this is not just for your FCPS or MS exam. If you are appearing in an exam, DOMS, Diploma in Ophthalmic Medicine and Surgery, and also in MS, or if you are appearing in Glasgow exam, FRCS Glasgow, at the end of all three parts, which is the theory part, at the end you have Viva exam. And you will demonstrate to yourself that I know actually these things with in every short case there are 4 domains, and you have to focus on that. And you have to focus on that. That is knowledge. First, they are evaluating you. You have the good grip on your knowledge or not. In that particular, for example, they are giving you a case of strabismus. If you have a good grip on that, you can evaluate good patient, you can debate with examiners. Then the clinical assessment of case. For example, history and examination. When you are evaluating your patient before debate, you have to follow the precise methods. At that time, they are evaluating you. Are you doing that particular methods according to rule and regulation, or just you are doing? Okay, we can do on different methods extraocular movement. Okay. But if you are doing according to that rules that we have at age, you have to go like this, so you know that. And if history and examination is so important, first was knowledge, number 2 was clinical assessment, which is history and examination, and you have to be careful at that time. And also in presentation, when you have done this at the end, you will come to the examiner. You have to verbally express what you have find. You should be very fluent. Your words, your adjectives, your nouns, your vocabulary, they are assessing. At the end, you should have a good time management. You know that for every short case we have 10 minutes. 10 minutes for the whole. 5 minutes for examination and history, and 5 minutes for the interaction with the examiner. So if you have achieved these 4 parameters, you have a good knowledge, you have done a very good clinical examination and history, you have done, and also you have presented well to the examiner and also on time. Within 5 minutes you have completed everything, you have presented well, you have passed the case. In ophthalmology we have 4 short cases, 2 from anterior segment, 2 from posterior segment. Time is 10 minutes, and also 5 minutes for examination and 5 minutes for Viva. What will be the expectation of the examiner? This is the question. If you have completed that expectation of the examiners during your exam, you are passing the exam. So it is not a secret. Just they will not ask you a question that you don't know. They are giving previously, I will show you later, they have given a complete template in which area we are asking the question, from how we are asking, what you will bring with yourself. Just I'm giving an analogy. For example, when we are going from this world after death, in this dunya, Allah has given a prophet, and they have given a clear message. From this way you can go Jannah, from this you can go hell. So they are giving that all the parameters. Okay? They are given all the parameters. If you have fulfilled that, so you can go to Jannah. So I am giving just that tips and tricks. If you have fulfilled that, you are passed. Acha, the expectation of the examiner will be pick all significant finding and reach diagnosis. You should. In all. And also you have to give differential diagnosis of every case. If that is neuro-ophthalmology, if that is a cornea, if that is posterior segment retina, diabetic retinopathy, everything. You should pick all significant findings and reach diagnosis. You have to give differential diagnosis. What to do next in this patient? All the examination and investigation. And also what is the new improvement in this, and also management plan at the end. you have to give management plan for the patient. There will be 5 typical questions in every viva after 5 minutes. You know we have 5 minutes. In 5 minutes they will ask you very precise question, not a long question, and you have to give a very precise answer. What is asking the examiner? According to that, you have to give your answer, not the knowledge you want to impress your examiner. No, that will not give you any benefit. What, for example, there will be 5 typical questions. Describe the finding. Okay. Number 2, what is your most likely diagnosis? What is your differential diagnosis? What investigation you will perform in this patient, and also how you will manage this patient. If you have answer for these 5 questions, we have 5 minutes and 5 questions, so you have passed that exam. That one first short case. I have forwarded to you that PPT of this, so you can find this assessment forum for short case. This will be with every examiners. According to this, they are assessing you. Okay, in this assessment forum, in the first 30 marks will be from the clinical examination. You can see there. So don't be careful during your examination and history taking. So they are actively evaluating. Okay, there are 2 examiners. Examiner number 1 and one is examiner, another is co-examiner. Everyone separately they are evaluating you. So you have to be careful when you are performing any kind of method that should be according to rules and regulation. And you have to be respectful to your examiner and also patient. So be careful. That has 30 marks. And the next is discussion, which has 70 marks. And what they are asking for from you, give the correct findings. Okay. वो क्या है वो सवाल चन्ना जवाब गंदम. So you have to give correct diagnosis, correct finding and correct diagnosis. So give the correct findings with logical interpretation. That has 25 marks. Okay. And also justify diagnosis. If you are saying anything, any diagnosis, you have to justify it. You should have a background knowledge regarding that. If you don't have, it will not work for you. And also at the end, suggest appropriate and relevant investigation and management, including recent advances. This has 25 marks. So according to this, there are 5 categories. Number 1, if you have performed very well, okay, in clinical examination you have performed very well, you have according to rules and regulation, you have performed all assessments, so you will take 30 marks from that. Or if you have done a very good discussion, okay, they will give you 70 marks. Excellent. Or if you are at the next level, that is good, 24 marks. If adequate, 18. If inadequate, 12. If it is poor, 6. So if you are poor, so you have failed that particular short course. This is in the next slide you can find. In the next level is that FCPS roadmap. FCPS we have a roadmap. Now some PGR are in year 1, year 2, they will appear in IMM exam. Some PGR are in year 3 and 4 and they will appear in part 2 exams. So this is I have given one picture you can find here. This is what will be the command from the examiner. They will ask you question. Please do, there will be a patient, or maybe there will be a scenario or a photograph. They will ask you, please do the anterior segment examination of the right eye. You will not go for the left eye. You have to follow the command, right eye. Okay. So then you have to do the anterior segment examination. You have to not take your 90G. Okay. So they will ask you regarding this. They will give you 5 minutes. Okay, you are doing step down examination. You are doing fluorescein test. Everything you want to do but that should be relevant. Okay, if you want to pass that short case, that should be relevant. You are doing. They are not discussing that 5 minutes with you. Okay, after 5 minutes you will come. An examiner and co-examiner. They will ask you that 5 typical questions. What is your finding? What is your diagnosis? What is your differential diagnosis? What is your management plan? So if you have a particular answer for these 5 questions, so you are passed. For example, in this particular picture, we can say, what is your finding? So we will say that this is a photograph of anterior segment or cornea, which is showing the cornea with palpebral fissure. There is multiple opacities. Okay, and what is your diagnosis? It's a case of band keratosis. Okay, and what is your differential diagnosis? We have different differential diagnoses. Anyone can say the differential diagnosis of this patient?
जैसे स्टिक पैटर्न का पेयर बचिए इसको क्या कहते हैं वॉक निम्बल गर्डर जी और इसके अलावा स्फीराइडल लॉर्ड की तरफ आ सकते हैं कॉर्नियल ओपेसिटी डिजेनरेशन की तरफ आ सकते हैं और
one trick regarding tips and tricks regarding this that okay, he has said 3 differential diagnoses. Okay, so you have to not say, for example, just you have memorized that this particular case has 10 differential diagnoses. You have to not say there are 10 differential diagnoses. You have to start just 1, 2, 3, 4, 5. You have said 5, okay. If you have said just 3, you are passed. Okay, they will not ask you 10, but at least you have to find a minimum level you have to achieve. Don't say numbers that there are 10 differential diagnoses. Maybe at that time, due to exam stress, you will forget. Okay. And also, they will ask you what is the cause of this particular disease. Anyone?
काफी सारे हैं
Please, बता.
इसमें हमारा क्रोनिक इन्फ्लेमेटरी डिजीज होता है क्रोनिक इन्फ्लेमेटरी डिजीज हो सकती है जिसमें हमारा सिलिकॉन ऑयल हो सकता है क्रोनिक यूरियाइटिस और इसके अलावा अगर सिस्टेमिक डिजीज हो सकती है हाइपरपैराथायराइडिज्म हो सकता है या हमारे कोई कैल्शियम
इंक्रीज बॉडी कैल्शियम लेवल
इसमें हमारे ट्यूमर भी हो सकते हैं और हाइपर कैल्सिक कोई भी हमारी पैथोलॉजी हो सकती है
Acha. Then they will ask you again, what is your management plan? Next question.
PKP.
Chelation.
Chelation and PKP.
Acha. How he will eat? He will drink?
पहले अपनी पीरियड स्क्रैच करनी है उनको ब्लेड से 15 वाला और उसके बाद आपने कॉटन टेप में उसे करके उसको एटलीस्ट 5 मिनट के लिए स्क्रैप ऑफ करोगे देन वो चिलेशन एजेंट अपना काम करता है एंड फिर क्रिस्टल बन के फिर आपको वॉश आउट कर देंगे
So this is a specific answer. So at that time there is very short time. You have to not give answer from this. Okay. If you don't know any answer, just you will say sorry, sir. Okay. If you don't know, just give a confession. But you have to not give a wrong answer. Don't confuse yourself and examiner because you don't have more time. Please.
वो कहते हैं कि आप किसी भी क्वेश्चन का आंसर नहीं मान सकते जिस से भी आपने पूछा है कि चिलेटिंग एजेंट कौन सा ईडीटी है अगर वो नेक्स्ट ये पूछे कि हाउ ईडीटी वर्क फिर हम नतीजा वो बताना चाहते हैं
अच्छा so the management plan we have discussed for this particular short case if you have answered for that particular 5 question you are passed अच्छा the next I have given you can see your these are a specific instruction from the CPSP regarding ophthalmology examination part 2. In part 2, you know we have long case and long case here 60 minutes, 30 minutes for examination and history, 30 minutes for discussion. That will deal with one long case. And also we have short cases, there are 4 short cases. And you should pass at least 3 of them. you have just a margin of 1. If you have failed one, no problem. But you should pass 3. And also we have TOPS exam. In TOPS exam, that is 1 day before short case and long case. So first you have to qualify for short and long case. This was a question from, I have asked from Rausa, that how there will be exam talks. He said on the first day there will be talks, there will be a list, okay, for past exam. And if you have qualified for short case and long case, then you can come to that examination center. So the next is a short case. In short case, they have given a clear instruction. There will be 4 short cases. There will be 40 minutes for every short case, for all short cases. Discussion will be regarding give correct finding, give logical interpretation in finding, and justify diagnosis. Diagnose or diagnosis. Okay? What we have discussed previously. And also detailed instruction for the candidate, and also this note. You should be you should have some instrument with yourself that they will not provide for you. Examination center, like you should have fluorescence strip, you should have direct ophthalmoscope, you should have 90D. Even they are asking that you should have your indirect ophthalmoscope, retinoscope. These are mandatory for yourself that you should bring with yourself. And also you can see this second one. This picture, they will ask you questions. That it may be a patient, okay, it may be a picture or photograph. They will ask you, please do the examination of this patient. You have to do the relevant examination of these questions. So first question will be, please describe the findings. Dr. Bilawal, what is the findings of this particular patient?
It is a correct photograph of both eyes, anyway, that little body as well.
Okay. So the next question will be, Dr. Faraz, what is your diagnosis?
Differential diagnosis.
No, first diagnosis, then differential. Next step by step.
या तो इनका क्वेश्चन होगा बट योर impression
Yes.
Flat congenital paper.
Let him if he cannot explain, then I will come.
My impression is left
Where you
RB.
are
RB.
Left retinal glasses.
G.
RB, retinal glasses.
Acha. So when you are using during exam any particular abbreviation, that should be according to, that should be mentioned in bold. You have to not use very jargon. Okay, if you are using RB, you have to say retinoblastoma or RB, or because they don't know, they just know from your mouth, they don't interpret your brain. Okay. So the next question will be Dr. Jawad. Yes. The next question will be, what is your differential diagnosis in this particular patient?
Congenital cataract.
Good.
PHPP.
Good. PHPP stands for?
Persistent hyperplastic retinal
Good.
dense vitreous hemorrhage.
Dense vitreous hemorrhage in this patient with?
Coarse disease.
Acha.
Acha.
So the most common is which one? In this particular patient, the age.
Retinoblastoma and
Good.
congenital cataract.
So the next question will be, Dr. Mudassir, what will be the management plan for this particular patient?
So first of all, we will go for investigation.
Like?
We will do fundus exam.
Good.
If the superstitious allow us to examine the fundus and vitreous. We will go for B scan.
Good.
And if B scan has some superstitious, we will go for the CT scan.
So when you are saying that you want to use the B scan, then you have to justify your investigation also. What do you want to find in B scan? And this is the next question.
we want to confirm the status of funders and any provide in the college.
Provide with the college. Okay. So at the end, Dr. Simal, what will be your treatment in this particular patient?
Basically, in this particular patient, if we are going for like retinoblastoma, then we have to decide a multidisciplinary approach where the surgeon, ophthalmologist, and oncologist will be deciding together that what they are going to do. Either they are going for or they are going to have surgical.
So, for example, we can say it depends. We have to go first for EUA, then we have to evaluate in stage. In which stage is this retinoblastoma? Then, according to that, if that is in the early stage, we can go. We can spare the eye. We can save the eye. Okay, we have to go for chemotherapy or radiotherapy. If that is in the very advanced stage, we cannot save the eye. Then the priority is the patient's life. So we have to do innovation. Thank you.
और एक और इम्पोर्टेंट चीज जो आप बोल रहे हैं पेट स्कैन जरूर करवाना और एमबीपीएस है ना एब्डोमिनल अल्ट्रासाउंड होता है आपका ब्रेन में आपने मेट्स क्योंकि मेनली तो जो आपके लाइफ में डेंजर करते हैं वो ये चीजें ब्रेन में मेट्स आ गए तो वो आपका मेनली डेथ का कर रहा
Thyroid scan.
Okay. Next will be, I have some advice for at the end. If you follow these advice, inshallah, you will pass the exam. Especially short case. Complete all your examination within 3 minutes. Okay. The early, if you complete early, so then you have a time that you have to record. For example, findings, diagnosis, differential diagnosis, management plan, everything. Then you can prepare yourself for the discussion. So if you are achieving this level, so 3-minute level, so you have to work very hard in OPD. And OPD on multiple patients, if you are evaluating the strabismus, if you are evaluating the corneal pathologies, posterior segment pathology, diabetic retinopathy, retinoblastoma, retinitis pigmentosa, you have to work very hard. So it is impossible that you have not seen previously fundus or you want to see at that time. Cannot happen. So number 2, when you know the diagnosis, don't when you know the diagnosis, you have a good grip on that particular topic. So prepare the findings, give the differential diagnosis. Or each short case has some reason. Without reason, they are not putting any short case. So you should find that reason. And also, when you complete the examination, give a treatment plan also. If, for example, you have tried your best, you have not reached your diagnosis, then what you will do? Then it is a trick that you just explain your finding, okay, give differential diagnosis, give, the next they will ask you the question regarding that. And for example, if you have not reached the diagnosis or differential diagnosis, just take permission from your examiner. Please let me to examine the fellow eye. You have to take permission. Without permission, you are not allowed. You have to take permission from the examiner. Let me to examine the fellow eye. And if you know the topic well, you start early. And I have explained previously that there are 4 cases. If you have passed 3 cases of them, you have passed the exam. So just you have to margin. And also be polite to your examiners, be polite to patients, and also your appearance should be professional and you should have white coat there and everything should be okay. Appearance is so important at that time. And you should have your own instruments that fluorescein, direct ophthalmoscopy, everything. Thank you from your time and attention. Any questions?